a postpartum assessment on this patient. I would have already shut the door and made sure that she had enough privacy. I would go into my patient's room and introduce myself. I want to perform hand hygiene, and next, before I do the assessment, I'm going to put on gloves. Okay, so the first thing I want to do is to assess my patient's vital signs. I want to get a temperature, which there's no thermometer in here, but we'd take her temperature orally. We'd get the SpO2, we'd count her respirations, we'd put on a blood pressure cuff, and then I'd also be counting her respirations and listening to her breath sounds. So I'm going to go ahead and do that. Okay, and everything sounds good for this patient. So after that, I'm going to pull back the covers, and I want to listen to her bowel sounds. I want to make sure that she has adequate sounds in all 4 quadrants, so I'm going to go ahead and listen to her. Okay, and everything sounds good. So after that, we want to be palpating for the fundus, and this we would use 2 hands, and we'd want to feel for a lump, and then we'd want to say where we found it. And like hers is midline, but it's below the umbilicus, and it's firm. Next, we want to go ahead and palpate her breasts. We just want to make sure that there's no lumps or like tender areas. So we would feel in circular motions, and I'd ask my patient if she's having any pain, and she says no. And you do that on both sides. And okay, everything feels good, and she didn't have any pain, so that's okay. And we want to ask my patient, like, when she last went to the restroom, both bowel movement and urinating. This would help us to get an idea if everything is working properly. Another thing, I didn't say this earlier, but when you're feeling for the fundus, if it's off to the side, that could just mean that the patient needs to go urinate and the bladder is actually moving the fundus off to the side. After this, I'm going to look at the lochia, and this is like the bloody discharge that comes out after birth. So I go ahead and look at that, and I'd want to note like the amount of how much there is, and like keep track of, make sure that not too much is like coming out, because that could mean something is wrong. We want to make sure that it has no like unusual odor to it, and if there is any clots. Clots are fine as long as they're smaller than golf ball size. And then after that, you would want to go ahead and also check down there, like if the patient had an episiotomy or lacerations or anything, you'd want to check down there to make sure and note any like redness or swelling, and whether like the edges of the wound are approximated. One of the last things you want to do for this assessment is to check the patient for any DVTs, make sure like there's no blood clots. So when you're looking at the leg, you want to look for any redness, you want to feel for tenderness and any warm spots that you find. And this patient looks fine, and she's not having any pain or anything. And then the last thing I would do for this patient is to make sure she's comfortable, and I'd ask her if she needs anything, and then that'd be it.